Hi, everyone. Thanks for joining us early on a Saturday morning. My name is Abby Schlesinger. I'm a child and adolescent psychiatrist. I'm the medical director of Smart Choices, which is who's bringing this to you today. I'm also the chief of child and adolescent psychiatry at Western Psychiatric and Children's Hospital, as well as integrated care. This presentation today is going to be a taste of some skills that are evidence-based and designed specifically to help parents when their kids are using substances. And we've entitled it Parent Guide, Helping Your Child Change Their Substance Use. A little bit about us. Smart Choices is a component of Children's Community Pediatrics and Children's Hospital Foundation, as well as Children's Hospital. And we were designed specifically in 2013 to prevent the lifelong consequences of childhood and adolescent substance use. We've had many initiatives since 2013. Probably the most notable is a program where we screen adolescents for substance use in primary care. Our primary care physicians throughout Western Pennsylvania, pre-COVID, were screening about 7,000 children a month for risk for substance use. And as a part of that initiative, we've trained all of our pediatricians in Children's Community Pediatrics to learn to talk better about substance use so that they can help youth and families when they come for their well child visits. On that note, my friends at Children's Community Pediatrics have reminded me to remind everyone on this call to please schedule your well child visit because it's an important part of growing up, and our pediatricians miss those of you who they haven't seen recently. So I'd like to welcome everyone that's here, and basically anyone who feels like they're part of helping to raise a child, we're happy to have here. Parents, step-parents, grandparents, aunts, uncles, foster parents, adoptive parents, and other caregivers in case we missed any sort of person that might consider themselves someone who helps a child. We know that raising a child and an adolescent is difficult. And that when substances get thrown in, it can be even more difficult. And these tools we're going to give you, or actually I'll show you later what they're from, are evidence-based tools to help youth and families learn to gain perspective, how to help them take care of themselves, how to help parents talk to their children, and how to help parents react to their child when they're using versus not using. And the thing is, as we all know as parents, being a parent is tough and we all make mistakes. Learning how to use new tools is also tough, and even more tough when you have an adolescent who might not always like everything you have to say. So we really see today as a taste of some of the skills that can help us when we struggle with the changes in our adolescent. But when it comes down to it, it really takes practice, 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 and sometimes even practice with a provider to help you work through things with your children. So I really like to encourage your parents not to become frustrated if they try one thing and it doesn't work. Anybody that's had a baby knows you try lots of things when they're a baby and they may not work the first, second, or third time. You sort of have to learn as you go as a parent, and even more true for adolescents. I think the thing that frustrates us all with substance use is when things don't work, sometimes there are lots of different advice that don't line up. So we're here today to give you evidence-based tools so you know what's the evidence out there for what works. So our team here today is Shannon Meyer. She's our Smart Choices nurse coordinator. She has been involved with us since the beginning. She was involved in working with adolescents and older individuals with co-occurring disorders for years now, and has a wealth of expertise. Callan Weiser as well is more new to our group, but has a lot of expertise in family-based services and crisis management, and is a therapist. I introduced myself, and Colleen Gianeski introduced herself earlier. She's our Smart Choices program director. Just to remind you, these are our upcoming sessions. We're not requiring everyone to attend every single session, but you will get the most out of it if you attend all 4 sessions. I can tell you that a lot of work has gone into these sessions. I think Callan and Shannon have practiced no less than 5 times all the way through, probably more, and are very committed to doing the best they possibly can to give you all a taste of these types of skills. And there are the 4 dates and the 4 times. We'd love to have you all at every single one of the events. And here are a place you can go for more information. In addition, we'll probably be providing you more information and maybe even reaching out to you in the next few months. But the Center for Motivation and Change is really where we derived this presentation. So I want to give them full credit. We've been working with them. They are completely in support of us presenting this. They're great people, actually. And this 20-minute guide, if I remember correctly, is available online for free, but you could also, we'll have an opportunity for you to pick one up at your Children's Community Pediatrics office if you're interested. If you like reading more, the Beyond Addiction is a little bit of a thicker book and goes much more in depth into some of the science behind what we're saying, as well as some of the specifics of implementation. And then that website has a wealth of information about a variety of topics, everything from what to do if you find your first cigarette in a child's room to what to do if your child has a full-blown opioid disorder or other disorders. So we'd highly recommend looking at that site if you have more questions as well. So without further ado, I want to hand this off to Shannon. She really is the wheels that makes this work, and is a nurse who has a long history in substance. Take it away, Shannon.
Thanks, Abby. Since we're talking about helping with understanding today, I wanted to go over some of the benefits of it first before we kind of jump into more of the information. So you've probably realized in other areas of your life that the more you understand a problem or a situation, the better equipped you are to help with that. So when you start to understand things like what's contributing to your child's substance use or how that use is affecting your family and your other loved ones, then you'll become better equipped to look at some possible solutions and find ways to help your child. In the 20-minute guide, they refer to understanding as the light that you need to navigate a dark room. And I liked that example because I think that we can all relate to being in a dark room, literally at some point in our life when the lights went out, and noticing how much easier things get when you get a light, someone turns on a light for you. So I like to think about understanding as that light that you need. So as parents, you already know that parenting can be really difficult and complex just to begin with. And then when your child is using substances, that only increases. So you might start having some new concerns about your child if they're using, like how is this affecting their physical health and their mental health? Or you might feel like people don't understand how hard this is to be a parent raising a child that's using substances, and unsure how to help your child or how to communicate with your child and the rest of your family. So all of these things can really shake your confidence as a parent, and sometimes you might be left wondering if you're doing the right thing. And I think it's also important to remember that adolescents have a lot of difficulties and complexities going on as well. And then when you add in substance use, that increases for them too. They might be struggling with peers or social situations, and sometimes substance use is a way for them to socialize with their friends or loosen up so that they feel like they can fit in better. They're also still developing both physically and mentally. So sometimes healthy decision making is a little bit harder when you're younger in your adolescence. And there also might be some mental health disorders or academic struggles going on as well. So sometimes adolescents will use substances to self-medicate for things like anxiety or depression. So you might hear a variety of things as a parent. You might have friends or family telling you what you need to do with your child if they're using substances, or telling you that there's only one way to deal with a certain situation. They might be promoting that you try tough love, or they might be going in the opposite direction and telling you not to worry about it, that your child's just experimenting and that it's not a big deal. And so when you hear all these different conflicting things, it can be really confusing. And it's especially hard when you're hearing things that you don't necessarily agree with as a parent. So it's important to remember that one answer does not fit all when it comes to children and substance use. Then there's also not one thing that has caused your child's substance use. There's a variety of things that can lead to it, and some of those things are listed here on the page, but there's plenty of more things that aren't listed that can also be contributing factors. So I think it's important as a parent to remember that there's not a certain thing that you did or a certain one thing that happened in your child's life that led to this. It's really more complex than that, and there's a variety of things that lead to substance use. It's also important to remember that there's not one answer for everyone. So you need to think of your child as an individual and think about options that would fit them and their needs in their life. So to highlight the importance of options, I'm going to give you a little example to explain how having options is helpful. So if you were to take your child shoe shopping and you went into the store and there was just one pair of shoes there, and those are the shoes that are on the left-hand side of the screen, and clearly they're too big and they're maybe not the style of shoes that your child needs, and so they're uncomfortable, they're falling off their feet, but you buy the shoes anyway. And then there might even be some arguing in the store because your child doesn't want those shoes. And if you take the shoes home, then your child is likely to either refuse to wear them altogether because these shoes don't fit their needs. They literally don't fit their feet. Or your child may try wearing them maybe for a few days and give up on them because they're just too difficult, or they're having so many problems with these shoes. And then if you were to take your child shoe shopping and you had a variety of options for them and options that they liked, so the picture on the right-hand side, they would have the opportunity to try on different pairs, get a pair that fits, get a pair that they like and fits their needs. And so it would be a much more pleasant experience as a parent to go shopping and have all those options. And then also your child is more likely to wear those shoes in the long term since they fit them. They fit their feet, they fit their needs, and they like the shoes. So when we're thinking about different options for your child when it comes to substance use, it's important to have a variety to pick from so that they really feel like they're getting what they need. So there's a lot of power in understanding not only your child's substance use, but also understanding the need for those individualized options for them. That increases your hope both as a parent and increases the hope for your child and your family that there's going to be something out there that works. And it empowers you and your child and the rest of your family to participate more actively in treatment, which in the long term increases the likelihood of success. So this is an exercise from the Parent 20-Minute Guide, which you'll have available to you at some point. We'll send you more information on how to pick that up. And there's an exercise on the one answer does not fit all concept, where you would write in some of the comments that you might hear, either you've already heard in your life from other people or you maybe anticipate hearing, and then what you know to be true about your child. So we'll go with the first example there. You might hear that you should send your child away to rehab if they're using, but you know that your child may not need that intensive of a treatment at that time, and you want to try first to help your child make some changes in the context of their normal life at home with you. So really thinking about those things you don't agree with necessarily that you're hearing, and then thinking of what you know to be true so that when you hear those things, you can refer back to what you know about your child. So I want to remind you that you have the opportunity to ask questions using the question and answer box. So please feel free, if you have any questions on those slides I just showed you, to put them in the box, and I'll be checking that as Calvin takes over the next part of the presentation here.
Calvin, I'm not sure if you can hear me, but I think you may be muted.
Oh, my bad. So as a parent, you're probably wondering why your child is using substances in the first place. You have taught them that, substances, aren't a path you want to go down. It doesn't make sense that they're using, you're physically seeing that they're getting in trouble with their use and still using. or you're having conversations with your children and they're saying they're going to stop, but they don't stop. So it can be very frustrating as a parent to see them struggle and not know why. So there are a million reasons why your child might be using substances, as Shannon said before. There's all these different factors. But for your child specifically, the best way to find out why they're using is to ask them directly, because only your child is going to be able to tell you what's true for them. So some of the responses you might receive from your kid is it helps them be more social. They feel more comfortable in their skin, you know, they're more fun at parties, they're more fun hanging out with their friends, they're not as worried. Or if they have trouble making friends, this could be their way of having that social group that they want. Decreasing some anxiety and depression symptoms if they're having them, you know, finding something to kind of relieve that stress. Or help them focus in school. You know, as parents, you want them to do really well and succeed in life. And if they're having a hard time focusing, they may need to find something else to help them. So there's a lot of benefits once you understand the why behind their behavior. It lets you as family members not take their behaviors personally. It's not something you're doing, it's something that they're finding helpful for them. Increases your compassion, because I know watching your child use substances is incredibly frustrating, but once you have a reason behind, you know, why they're using, it kind of makes it a little bit more easier to understand. And allows your family to come together and figure out how to work through this issue together. So in this way, you're not feeling alone in it. And it decreases your fear and anxiety and anger. You know, as a parent, it's understandable to be angry and frustrated, you know, and scared that they're going down this path that you don't want them to. But having more of an understanding of the why is going to help you better understand how to make positive changes and encourage your child to do activities that are going to be more positive for them. So now we're going to open up to any more questions here. Just add them into the question and answer box, and I'll answer them while Shannon switches back to presenting.
So I want to take a few minutes to talk about ambivalence, since it's a really important concept to understand when you're thinking about how people change. And it might be a word that you haven't really used much or heard much in your life, but you've likely experienced ambivalence several times in your life. And it's really having mixed feelings or contradictory feelings or ideas about something or someone or some change you want to make in your life. And so it's wanting to go in two directions at the same time. And what makes change really hard is that you have good reasons to go in both directions. So deciding what way to go is difficult because there's good reasons. So as a family member, you may hear things like your child's not ready yet, or they're lying to you, or they'll go back to using if they can. So when you hear those things as a parent, just keep in mind that your child might be experiencing ambivalence, and that they may actually be wanting or having feelings about wanting to change, and it just might not be as obvious to an outsider that is talking to you. So you can also hear ambivalence in the way that your child talks about certain experiences and decisions in their life. So once you recognize that there might be ambivalence going on, you can look for some of those clues in your conversations with your child. So ambivalence can change very quickly, and in the 20-minute guide, they refer to it as a motivational seesaw. And I like that visual because I think it represents well how quickly motivation can go up and down. So there's just a little example here about how when we're thinking about teenagers, they might wake up for school late one day because they were out drinking the night before. So they might think to themselves, my mom's going to be really mad. I'm late for school again. I shouldn't have had so much to drink last night. And so in that thought, they might be thinking that they should probably make some sort of change in their life. And then by 12 o'clock at school, their friends are telling them that they were really funny at the party. And so they think to themselves, the alcohol really helped me to loosen up and to relax at that party. And so maybe at that time they're thinking that they want to continue their behavior since they're seeing benefit from it. Then after school, they know dad will be home soon and he's going to ask about why they came home late last night, and not wanting to lie to him and starting to think maybe they need to make a change again. And then at around bedtime, maybe the friends are sending pictures from the party. Everyone's talking about how fun it was. They can't wait for the next party. So then we're back to maybe continuing the behavior. So that shows you just how quickly throughout a day motivation to change can change. And it could happen much more quickly than this even. It could happen really from minute to minute. So this is also an example and an exercise from the 20-minute guide, and it's highlighting that change is a cost-benefit equation or balance. So there's they encourage you to fill out some reasons to change, and they use a common example of exercise, since a lot of people have thought about making that change in their life and struggle with that. So they have you fill out reasons to exercise and then reasons not to exercise. So we'll go to the next slide where we have some of the examples that they filled in for us to see how that would look. So common benefits from exercising, as we probably know, better health. You might feel better about yourself after doing it. And then some of the costs that people usually associate it with it, extra time at home might be lost because you're at the gym, paying for the gym, things like that. So both columns have really good reasons, both to exercise and not to exercise. So knowing that there's good reasons in both categories, you can see why change is so difficult. And ambivalence is very normal. I think when we talk about it, sometimes it gets a bad rap that maybe this is a bad thing, but it's a really normal thing, and it's part of being human, and it's part of the change process. So I encourage you to just really keep that in mind when talking to your child, and when you notice that they're ambivalent, that this is a normal thing. Your child is getting something from substance use. There's some sort of reinforcer there. And if they didn't have something positive that they were getting out of it, they wouldn't continue to use. But as a parent, you see all the costs that are associated with them using and all the bad things that happen or could happen in the future. And so it's really hard for you to accept that when you see the cost and they're so clear to you as the parent. And some days changing will make sense to your child, and others it won't, or it might fluctuate throughout a day, like in that example I showed. But the new behaviors that they're trying to implement in their life are still competing with their old behaviors, so their behaviors of substance use. And it really is a competition. Some days the new behaviors will win, and some days the old behaviors will win. And it's important to remember that the old behaviors, the substance use behaviors, still work for them, and they work with predictable responses, and your child knows that. So knowing that they could go back to using and get a predictable response and get what they are benefiting out of it is very tempting. So remember to keep in mind as a parent that that is something that's really hard to let go of. And ambivalence is also sensitive to the responses of others, especially parents. So if you're arguing with your child, your child's more likely to try to defend their reasons for not changing. But if you give them some room to reflect on their own reasons for changing, that's usually beneficial because their own reasons are the most powerful reasons, and that's what's important to them. So even though it's hard to sometimes not argue about substance use and give them some room, it can really be more beneficial in the long run. And then once you understand ambivalence as a family, it allows you to have more compassion for your child because you can relate to those difficult decisions about change and think back about some difficult changes you've made in your life. And then you also realize that your child's gonna have good days and bad days when it comes to change, and it's not a steady course, it's more of a jagged course. It also gives your family something positive to work on with your child, so developing some new communication skills to help with the change, which is in one of our upcoming sessions. We'll talk about communication. And also it helps the families view the child as being stuck instead of in denial. And it's a lot easier to have compassion for someone that's stuck than it is for someone that's in denial, because when you're thinking about someone in denial, you're thinking that they're not willing to change or not wanting to change, and that's not necessarily the case. They might just be stuck in the change process and ambivalent. So when you're talking to your child, there's some red lights that might come up, and those are the things that you either hear or different cues in the conversation that let you know that this conversation isn't going well. So I think we've all probably been there in conversations where you're hitting these red lights. And so I just want to remind you as a parent, that might be a time that you want to slow down the conversation and stop for the time being, since you're not getting to a productive point. And then going back and resuming the conversation when emotions aren't so high, since you're not likely to get to a good spot when you're hitting all these red lights. There's also an urge to use the writing reflex when you're talking to people, and especially your child. So it's really that desire to fix the problem that might be very obvious to you. So there is actually this video that Colleen will be pulling up on YouTube. This is to highlight that writing reflex and how when you're using that sometimes it's really counterproductive to what you're trying to do in the conversation.
All this pressure, you know, and sometimes it feels like it's right up on me and I can just feel it, like literally feel it in my head, and it's relentless, and I don't know if it's going to stop. I mean, that's the thing that scares me the most, is that I don't know if it's ever going to stop.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I mean, I'll bet if we got that out of there.
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing.
You always do this. You always try to fix things when what I really need is for you to just listen.
See, I don't think that is what you need. I think what you need is to get the nail.
See, you're not even listening now.
Okay, fine. I will listen. Fine.
It's just, sometimes it's like there's this achy, I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. I mean, all of them.
That sounds really hard.
It is. Thank you. Ow!
Oh, come on. If you would just
Don't.
try to see things mild.
So I like that video because it's funny for one thing, but also it really shows that when you're trying to fix someone and that's not what they're looking for in the conversation, that it can really not get you anywhere. And then when you heard the man say to the woman, that sounds really hard. It was just 4 simple words that he said, but it really made all the difference with her. That's what she needed, is for him not to try to fix her in that moment, but to really understand where she was coming from and show that he was listening. So even sometimes those really simple statements acknowledging that it might be hard for the person you're talking to can really change things around. The writing reflex can hinder sometimes those deeper conversations that start to pull out some reasons for change. So I would just keep in mind that it's something that we all naturally want to do in conversations, is to fix who we're talking to or solve the problem for them. But sometimes just listening and acknowledging is what is needed at that time. So I'd like to remind you that we're taking questions in the Q&A box. So if you have anything, please type it in, and I will be checking that as Callan takes over the next portion here.
So parenting now for you is very different than parenting when your kids were young. So looking at the left side of the screen, kind of describes how you felt when your kids were little. You know, as soon as they were away from you, you were really upset. You wanted them back with you. And then the moment you got them back, they were, you know, incredibly in your space. And from the minute you got with them, you were like, okay, go away for a little bit. I need some breath. But now you're parenting teenagers, and it's a much more complicated situation. And to add substance abuse onto it, it gets even harder. So you may now be relating more so with the words on the right side of the screen, you know, hearing that you're a good parent, you're a bad parent, that you need to hold an intervention for your children, you know, or you need to let your children hit rock bottom. You need to have tough love. You know, these are all really black or white things to think about. You know, it's not one or the other. It's not all or nothing. You know, when it comes to this all or nothing thinking, it really limits your choices and how to help your children moving forward. And the all or nothing thinking can be really shaming and discouraging for your family. You know, it leaves you frustrated and you feel like your child's substance use is so much more powerful than anything that you can do at this point. So you have limited options. So you're left with feeling like you have to let your kid hit rock bottom, and you don't know what rock bottom is. You know, you don't want to watch them struggle. You don't want to watch them continue to hurt themselves, but you also don't want to go down the path of confronting them and forcing an option on them that they may not agree with. You know, this kind of thinking is not accurate, and it's not helpful for you as a family to come together and make the changes that you want to see in your child's behavior. So a good thing to work towards and helping making this positive change with your children is to allow natural consequences to occur. And this is something that's incredibly difficult to do as a parent. But a natural consequence is the direct negative outcome of your child's behavior. So this is not something that you're helping with. This is something that your child does specifically on their own. So, you know, they're old enough to wake up late if they want to go out, and they have a baseball game and they arrived to their baseball game late because they got up late and now their coach isn't allowing them to play. That would be an example of natural consequences. They did this, they don't get to do this. Same could be said for, you know, not doing their schoolwork. You know, they don't feel the need to do homework after school. They don't feel the need to study. They just want to use. You know, they're not going to complete their school assignments. They're going to fail the year. And now all of a sudden their friends get to move on to the next year at school and they're stuck a year behind. So natural consequences, as I said, are very difficult for parents. You know, you don't want to see your child struggle. You know, you want them to get everything that they can out of life. And really, you may want to step in and, you know, help them, take some of that burden off so they can still do what they want to do. But allowing natural consequences to occur is going to really outweigh these barriers if you step in to help your child. You know, because the more you allow these natural consequences to occur, it's going to increase your child's motivation because they're not getting all of these fun things that they want to do, and they're going to really start to feel the consequences much more often. So in the 20-minute parents guide that you guys will be receiving or may already have, there is a worksheet in there that goes along with the consequences. And reinforcement kind of things. So in the left column, you would put in no reinforcement to change. So these are just status quo things that are kind of just happening day to day. So you have the ritual on Sunday morning to make pancakes for the family. You know, your son decided to stay out late with his friends using, and when he gets up at 2, 3 o'clock in the afternoon, you still make him pancakes anyway after you've made everyone else pancakes. So some ways to change that so you reinforce the positive non-using behaviors that you want to see would be, okay, your son decides to use off and on. You keep the tradition of making Sunday morning pancakes, but he only gets pancakes if he arrives on time, clear-headed to the table. If he gets up any later than that, if he wants pancakes, he's on his own to make them. So your role as a parent is to stay involved with your child and practice good communication skills. You know, the more you guys communicate to your children about what's going on and creating that positive influence, the more likely their motivation is going to continue. And as parents, you're in a very unique position to reinforce non-using behaviors and to allow them to have these natural consequences when it does happen. And a big thing is taking care of yourself. This is a really stressful situation to be involved in. It can take a physical, mental, emotional toll on you as a parent as well as a family. In our next session, we're going to talk more so about how to take care of yourself in the midst of all of this. So some things to take away from our discussion today is, as a parent, you are in this wonderfully unique role of being positive. You know, you can talk to them about this, you can help them motivate to make the changes you want to see to not use, and reinforce the behaviors you want to see. Using a positive approach is going to help your child in the long run listen more to what you're saying, and that's going to help them continue to make the changes that you want to see. And constantly reminding yourself that change is not going to be a simple process. It's going to take time, you know, but it's going to eventually happen the more you work together on it. And it's really important to practice all of these things that we're talking about, not only today, but in the upcoming sessions. You're not going to get it right every time, but the more you try and the more you experiment, you know, the more you're going to learn how to incorporate these things into your own family system. And things are going to change, you know, at a certain point. So the more you try, the more it's going to work for you. And to take pride in it. This is not something easy to do. You know, we're giving you a lot of information, not only today, but throughout the next sessions on how to maybe change your ways of communicating and parenting and taking care of yourself. So when something does go right, you know, giving yourself that pat on the back, saying, yes, it does work. And reminding yourself to be kind to yourself. You know, these are a lot of concepts, and you're not going to be perfect at it the first time you try. I know, learning all of this stuff myself, you know, it's not a simple thing. So it's okay to have some slip ups. They're going to happen, but as long as you keep trying, it's going to work out for you. So we want to thank you so much for coming to our first session, for helping with the understanding. We hope that you really got some good information and you found this helpful. We would also like to really thank CCP for helping us out and, you know, kind of backing us for all of this and giving us the opportunity to reach out to, you know, not only you as parents, but as well as, you know, your children to help. Our next session is going to be helping with self-care, and that'll be Wednesday, July 29th at 6 p.m. So we're going to open it up to any final questions that you have.
I have a couple things. Shannon, I think you responded to a great question, and I can't see the answer in the Q&A. So do you mind saying the answer to that question about, I can't see the question right now, but I see the thank you.
Yeah. The question was, what if your child's reluctant to talk about usage? How do you approach the topic and get them to open up? Any tips for that? And so I wrote back is acknowledging that this is a hard topic for your child to talk about could be a good start. That just acknowledgement of this is hard and I appreciate that you're talking to me about this. Also asking open-ended questions, so questions that can be answered with a few words or a yes or no. And we're actually going to go more in detail on the open-ended questions in the helping with words session. So that might be one that you want to check out, since we'll really dive deep into that. But open-ended questions, and even asking them what they like about using. That might be something that gets them talking. It's probably not something that they would expect you to ask, or maybe they've never been asked that before. So that might even get the conversation going, is kind of asking them what they like about it and what they're getting out of it. And that will help you too with your understanding of why they're using, since you'll be able to hear what some of the benefits are that they're experiencing.
Okay,
I'm going to take the next question if you don't mind too.
Let's say
I'm going to read
that next question.
Yeah, it's a great question. Are there any recommendations for parents who have never used substances and whose child asserts that their parent doesn't understand why they like it because they don't know what it is like to be buzzed or high? I have lots of responses. It's a great question. I guess, first of all, do our teenagers ever think we understand anything about them, right? Like, their experience is unique, and that's part of being a teenager. It's part of the fabulous part of being a teenager, right? Because they're sort of experiencing the world and they think they're an adult. And we know they're not yet. But the great thing is, if your kid actually says this to you, it's a door to say, help me understand what it's like for you. So the big mistake we all as parents make every day for teenagers is we try to think we understand why they're doing what they do. And even if we might have used or tried something as a teenager, is probably different for them than it is for us. So I think asking them, say, hey, educate me, help me understand. It also goes back up to the question, I think the first person asked a question about how do I respond if someone says they like it or that makes them feel better. That they do like it. It probably does make them feel better in the moment. And the more you can understand what they like about it, the more you can help them come up with competing responses, which means other things they can do. But also, more importantly, and we'll talk more about this in future sessions, the more you can get them talking about what they like about it, eventually they'll start telling you things that aren't as good about it, or maybe that they don't like as much about their friends that use with them. And the more you get them talking about the positives, the more likely they are to throw something in that they don't like as much. And that I like to call the hook, right? If you start knowing the things they don't like about it, then you have a chance to sort of help them change their behavior. But ultimately, they have to change their behavior. They make their decisions. But the more you can understand about what they like and potentially don't like about the behaviors, the better you'll do. But I think, as a parent to a teenager, you don't have to understand exactly. You don't have to have had the exact experience that they had. I mean, there's no way we could have the exact experience that they're having. What we need to do is listen and help them start developing better decision-making skills, which is really that, and figuring out how to have friends is one of those are some of the major developmental milestones of adolescence. Those are great questions.
We just got another one. It says, I'm finding that in the world kids are living in today, there are very few natural consequences. They are continually given new opportunities, passing grades, even with minimal work, social acceptance, continuous opportunities to shine at things, even without working hard. Even smoking pot, as an example, is becoming acceptable in society. So without natural consequences, how can we teach valuable lessons?
Can I take that one? So there are always natural consequences, even with pot. So listen, alcohol is acceptable in society, and alcoholism actually probably results in more long-term disability at this moment than pot, although I'm worried pot may overtake it with how much it's being used. I think you're right that we struggle these days as parents with allowing children and adolescents to sort of deal with their natural consequences. And that's something we as parents need to all work on as a society. That our job isn't really to make our kid feel good all the time. Our job as parents is to help our children get to the point where they can deal with frustration, they can deal with bad things happening, and they can figure out how to manage those things. So I agree with you. I think there are some issues we have in society now with not allowing our kiddos to deal with natural consequences, but there are natural consequences everywhere. We talked as we put this together a lot about natural consequences. Sometimes the natural consequences seem so big that you don't want to let your kid experience them. And this is where having a therapist or someone work along with you might help you figure out how to come up with smaller ones along the way. Or if your kid is really struggling that much, they might have to deal with the big natural consequences. Now, as a parent, you can be there to help them after the natural consequence. But it's really easy in a busy world with a 2-parent family where everybody's working and running in all directions to accidentally do something for a kid to prevent the natural consequence. So, I often say, I think that's the hardest job as a parent these days, is looking around and making sure you're not helping the kid before they experience the natural consequence. It takes a lot of work. That's a great question, though. I think it's not, although society has changed a little bit about that, every parent every day probably has a choice about natural consequences, and even pot has natural consequences associated with it. We've heard a number of them in the people we've worked with. Mm-hmm. Anybody else want to weigh in on that one? That's a great question.
No, I think you pretty much covered that one. There is another one that says, my teen eventually gets frustrated and angry if I just listen and support. She also gets angry when I make suggestions, feels like a no-win so often.
I'll jump in on that one too. Mostly because I've been not talking for a long time and I like to talk. So, I think your teens getting frustrated is nothing new. Teens, but that doesn't mean that it's not something you should get support with. So if you feel like you're the things we often hear families say is, I feel like I might get in trouble for my teen. My teen might get upset with me at every pass. That could be a sign your teen has other things going on, like depression, or even that anxiety, or even that the substances have become such a concern that your teen is having trouble just navigating normal interactions with you. And if you really feel like it's a no-win at every pass, that's really a great time to get a behavioral health evaluation, get another person helping you communicate, because it's hard. And sometimes you just need a coach to help you through it and help you see if other things are going on. So I applaud you for trying to listen and support. And it's hard to know when to make suggestions. Sometimes just having a coach get in there, which is what I like to call therapists, can make a big difference. So all of your CCP practices either have a therapist in them, or you have access to a therapist who's probably pretty close to you. So I would recommend that if you're in this position where you feel like you're just in a constant no-win situation, it's not that hard to get a one-time evaluation with one of our therapists. You could even do it over video if you want to, and they can help you sort of work through these and figure out whether substance really is the primary problem, or whether it's just that they're a teenager and they don't want your help right now, or whether it's something else. So yeah, sometimes getting help when you feel like you're in that no-win situation is actually the answer.
I can add a little bit to that. Dr. Strode, this is Colleen.
Yeah.
I also think when looking at this, not only am I a provider, but I'm a parent of 2 teenagers, and it seems very, we're either listening and it's a very passive, or we're giving advice, or maybe even, making suggestions. And so I feel like part of my job as a therapist is trying to figure out what stuff goes in between. And so that the conversation we're going to have with helping with words is going to give some skills that I've been trained in, and others on our team, in motivational interviewing and asking open-ended questions and engaging a teen in conversation. So instead of just listening or just talking, I would encourage parents to think that there's a lot of other things that we can do to fill the in-between in conversations, to actively engage a teen in the conversation. And so I just wanted to offer hope and encouragement that there are some skills that we're going to be teaching. And I agree with Dr. Schlesinger that a therapist is a really great place to start to help support you in that, because this is challenging stuff.
I think that's a great point, Colleen. So there are some skills that we're going to talk about in one of our future sessions that actually take a lot of work. So you won't feel like you're just sitting and being passive. They take a lot of work to sort of help your kid describe to you what's going on with them. And in fact, it takes even more work as a parent, because it might mean you have to listen to things that make you uncomfortable. So it's actually work to listen in a way that evokes information. And then you might feel like you have that middle between just listening and supporting and giving advice, because we all want to give advice. But we all know advice doesn't work that well. I know it doesn't work that well with me when people just tell me to do something. So there are some really clear skills you can use for that. And if, coming to these sessions and reading the book or looking at the 20-minute guide doesn't help, a therapist can sort of help you use some of those other skills. It's a great point, Colleen.
Yeah, the hope is to get your teen to come up with the suggestions on their own versus giving them suggestions or advice. So it is challenging, but I'm excited to be able to offer some additional information in future sessions.
But there's a reason these series starts with understanding, because you have to accept first that you need to sort of let yourself understand what's going on with your kid. We all want to think we understand, and we all want to make theories, but only your kid can tell you. And you have to start in that position and being willing to accept that they might say things that make you uncomfortable.
I think I published one more comment, which is, will this presentation be available afterwards for review? I had to step out for a part of it. I'll go ahead and pass that off to Shannon. Do you want to share our plan?
Yeah, so the session that we did today, we believe is recorded through this format we used, so we may be able to upload this version. If not, we will go through and re-record it using a different platform and then put that on the CCP website. We'll get that on there, and we can send out some more information on how to access that, along with how to get the workbook from the providers' offices. So either it will be this version from today or the same material just re-recorded by Callan and myself, but we will get that up so that you can access it.
I'm trying to make sure I didn't miss any questions. Callan or Shannon, do you see anything that I missed in the Q&A section?
I was just double checking too. I think we got them all.
I would encourage you that if you register for today's presentation, you have our email address, which is the wpatips@chp.edu. Shannon, Callan, Dr. Schlesinger, and I all have access to that email. So please feel free to reach out if you have questions, if you would like copies of the slide, if you're interested in additional resources. We are happy to answer additional questions after today's presentation. So I do want to thank everybody for joining. I want to thank Shannon and Callan and Dr. Schlesinger, who did an amazing job today. I'm so lucky to work with them and also to be part of the CCP family that really takes a priority in recognizing adolescents in their pediatric practices as well as families. So thank you all for joining today. We look forward to hopefully seeing you next week when we continue this 4-part series. And I would encourage you to reach out to us using that email if you need any additional resources or support.
Hope everyone has a good day.